Mayors across our district report to me the dramatic increase in emergency calls connected to the epidemic.
The addiction epidemic has touched every community and demographic in America.
Right now, it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
Did you know about 42,000 people died from overdosing on opioids in 2016? That's about 116 people dying every day. The opioid crisis is one of the largest ongoing public health issues in America due to its high mortality rate resulting from drug abuse and drug overdose. But what are opioids? Opioids are highly addictive pain reliever drugs, which work by altering the brain chemistry. Some include hydrocodone, oxycodone, codeine, morphine, and heroin. They're usually prescribed by doctors. 75% of those who are addicted to opioids begin on prescription drugs.
The opioid crisis has remained an epidemic since the 1800s with the importation of opium in most industrialized nations, including the United States. With the modernization of society and the increased use of technology, opioids are more than easy to access, especially with the use of prescription drugs from doctors.
Some of those who misuse opioids begin with prescription drugs. About 80% of heroin users start with misusing prescription opioids. There are also other types of street opioids, including fentanyl, in addition to heroin. Fentanyl is 100 times more powerful than morphine and 50 times more powerful than heroin, and law enforcement need to wear hazmat suits in order to handle this dangerous drug.
It's really, really easy not to take them. And I think that's going to end up being our most important thing. Really tough, really big, really great advertising. So we get to people before they start, so they don't have to go through the problems of what people are going through.
President Trump's plan is similar to drug abuse resistance education, also known as DARE-style programs. However, according to researchers at the University of Cincinnati and the University of Central Florida, people who undergo DARE-style programs are just as likely to do drugs as people who do not go through DARE-style programs.
A major factor causing this kind of addiction to opioid drugs, especially for prescription drugs, is the lack of information doctors have and the discrepancies between doctors across the nation. As a result, our proposed solution includes establishing national guidelines and regulations that doctors can follow when they're prescribing and which scenarios they can actually prescribe these drugs under. Prescription drugs are only one part of the problem. People who are already addicted to opioids need effective treatment immediately.
Within the first 2 weeks following release, prisoners are 129 times more likely to overdose on opioids. To prevent relapsing and overdosing on opioids, 3 steps should be taken. Step 1 is detoxification. Treatment drugs prevent cravings for opioids, so by increasing access prisoners have to these drugs, overdosing will decrease. The next 2 steps include promoting healthy and sober lifestyles for prisoners through rehabilitation and addiction therapy. Step 2 is inpatient facilities. Inpatient facilities in prisons allows inmates to receive 24-hour care from therapists. These therapists help find the cause behind their addiction and teach them to identify high-risk situations that may cause them to relapse. Step 3 is outpatient clinics. After being released, former prisoners will continue to have access to therapists in clinics. Here, they will continue to receive help on how to live their lives without opioids.
We will use criminal penalties. We will use civil penalties. We will use whatever laws and tools we have to hold people accountable if they break our laws.
Rather than focusing on incarceration, it is important to focus on treatment and rehabilitation to help those who are suffering from opioid addiction, including those who are overdosing. We must talk about not only preventing overdoses, but treating them. There's currently a powerful drug on the market called naloxone, which can instantly stop an overdose if administered in a timely manner. We must require police officers, law enforcement, paramedics, firefighters, and similar agencies to carry this drug at all times. They are usually the first to respond in case of an overdose and can administer the drug, which can provide the valuable few seconds needed to bring someone to a hospital and save their life.
The FDA is an important part of our solution because they can establish national guidelines and educate doctors about the exact scenarios and situations in which opioid prescriptions actually need to be given to patients. However, the federal regulations aren't the only level in which this problem should be tackled. Local counties also need to work together in order to provide a community that's supporting any suffering people as a whole.
Congress must also work to expand Medicaid. According to the Kaiser Family Foundation, those who are covered under Medicaid are twice as likely to receive opioid addiction treatment as those who have private insurance or don't have any insurance at all. By expanding Medicaid, more people would have access to opioid addiction treatment.
Congress should pass legislation regarding the rehabilitation of prisoners, giving states categorical grants. The Bureau of Prisons and the Department of Corrections can enforce these new laws.
The opioid crisis is a national issue that requires the cooperation of many people in order to solve this terrible problem.